Welcome back to the Academy Table. I'm Renee De Silva, CEO of the Academy and your host. In today's episode, I had the pleasure of speaking to Anjali Kataria, the CEO and co-founder of Mytonomy. Mytonomy is a video-based patient engagement and education company. As you'll hear, Anjali is a true veteran of enterprise software and serial entrepreneurship, both from the private sector and also from her time working on cloud solutions and tech innovations at the FDA. I had a number of takeaways from my conversation with Anjali. First, I was struck by Anjali's experience at the FDA, where she worked on several 6-month, intensely mission-focused projects. To me, it demonstrates how diverse stakeholders, in this case, public and private sector, can accelerate progress through collaboration. Next, to produce their short-form videos, Mytonomy has an in-house film studio. Listen to the power of pairing creatives, technologists, and health experts. It allows patients to more deeply engage with their health while also helping clinicians by encouraging education from outside the traditional four walls. And then finally, her reflections on leadership. She keeps the focus on what you can control, like attitude and effort, instead of just a scoreboard. So with that, let's head to the table. Anjali, so happy to have you join us today at the table. Thank you so much for joining us.
Thank you, Renee, for having me. I'm looking forward to it.
So there's so much ground to cover with you. I've had the pleasure of getting to know you as a friend and colleague, but I'd love to just back up a bit before we jump into what you're up to these days at Mytonomy. Would you just tell us a little bit about your role as an entrepreneur in residence at the FDA during the Obama administration?
Sure. Happy to jump into that. Gosh, that was 10 years ago and such a wonderful group of people. I think my time in the Obama administration was characterized by just working with phenomenally talented people, both that came in through appointments, but perhaps even more importantly, all of the people that I worked with at the FDA that were civil servants. I think I didn't realize what an incredibly talented civil servant base we have that really sustains through multiple administrations. So my role was it was interesting. I came in 2011. There was a new program, you may remember or not, it was a while ago. Obama wanted to bring in private sector individuals into government, and we didn't really have a pathway for that at the time. So the Entrepreneur in Residence program was pilot tested at the FDA at CDRH. And it was a way to bring in folks from the private sector into all of our government agencies, with the FDA kind of raising their hand and going first, folks from the private sector and from the academic world on projects, on a mission. And so these were 6-month short appointments. I was part of the first team of 6. And we had a little bunker over at CDRH. It was very military oriented in terms of these analogies, but just a fascinating experience. We were charged with looking at how to rapidly innovate the device space for end-stage renal disease patients, where the most common therapeutic agent unfortunately, was a kidney transplant. We just didn't have great innovation in that space. And yet we had probably close to 20,000 patients with end-stage renal disease having kidney transplants every year. And at the same time, we had a wait list of almost 100,000 patients. So this was a big problem. So we created the innovation pathway, and you might be more familiar with the Cures Act, where it ended up getting codified over a couple of years into the Breakthrough Device Program. So that was my first mission. And then I was asked to stay on as part of the EIR program. And we then created PIF, Presidential Innovation Fellows. We had over 100 EIRs across multiple agencies by the time I left in 2013. And I stayed on at the FDA for a second tour. And in that time period, I also expanded my role to Senior Technology Advisor to the Center Director, Dr. Jeff Shuren, Devices and Radiological Health. And that was a really fascinating time period. We were looking at innovation using new technology. Software applications is really where I was looking at. How could we bring in enterprise SaaS? 10 years ago, cloud was still relatively new and very new inside of government. So bringing in enterprise SaaS applications was not an easy task because we didn't have all the regulations around it. FedRAMP and FSMA were just being crafted, and we were just learning how to use existing third-party applications at scale. I mean, typically government agencies had built these large enterprise applications on premise, So it was a fascinating time to see and to be a part of ushering in a digital transformation at government, which just operates at such a big scale.
That's amazing. So I hear thematically in that background, this theme around being really focused on missions. I love how you talk about that in sort of 6-month stints and then moving on to the next problem to solve. I hear a lot around activating around startups and tapping into that entrepreneurial energy to do so, both in a public and private domains coming together. So talk about then how that then led to the mission that you're on now, leading Mytonomy. Tell us a little bit about that journey.
Yeah. So going back to the FDA, I came into the FDA as a serial entrepreneur. So I came into the FDA from Silicon Valley, where I'd had 2 startups, and my second company was acquired by Oracle. And I was in the product lifecycle management space. We were in an enterprise software company. So that's really where that's really where I cut my teeth, is in the enterprise software space. And in FDA, one of my innovations, one of my tasks as senior technology advisor was to innovate around how government officials who were charged with regulating us could also adopt a second role or identity as a customer service agent to industry and to the people. And I was very passionate about this. I really wanted us to think of ourselves in government as agents, as service agents to the people, not just regulators. And sometimes those roles conflict, but many times they don't. And that is where I started to get really involved with CRM, customer relationship management, because a lot of what we needed to do from a workflow or behavior change perspective could then be also automated with the assistance of great enterprise software. And the category of enterprise software that really can help us understand the people we serve and to be better agents in serving those people is customer relationship management software. So that's where the 2 worlds kind of collided. And my enterprise SaaS background and what I was trying to do then ultimately took me to the executive office of the president, and I led Cloud First, which was an informal gathering of CIOs from different agencies, a handful of CIOs to start with. And over time, it grew to 11 CIOs of different agencies and their teams. And it was a roundtable. We all shared what we were working on related to customer relationship management, related to enterprise SaaS, related to Cloud First. How can we choose Cloud First over enterprise on-premise applications? And how can we also think about innovating, using technology to innovate how we serve our customers, ultimately the people and the industries that we serve.
So let's stay on that thread for a moment. This relationship between customer relationship management in healthcare, patient engagement, education, and then ultimately the experience. How do you think about the relationship between those sort of various component parts?
CRM, customer relationship management, is a set of application software that helps the owner understand their consumer or their member or their patient much better, and to deliver services to that individual in more effective ways. If you look historically, marketing departments have typically used CRM solutions along with like a HubSpot or other marketing automation tools to help reach patients, old and new. And they typically do this through campaigns. So come get your mammogram. They send you an email or they send you a flyer in the mail. Right before we had software automation, we were mailing campaigns to people. It's time for your annual checkup or time for your dental cleaning. So we've been running campaigns that are part of a CRM strategy, either manually or physically, and now many of those are becoming digitized. So that's probably the number one way people think of CRM. When I look at what Mytonomy is doing and how we're helping to reshape the future of patient engagement so that patients can lead healthier, happier lives, be more independent for longer, and really drive longitudinal engagement, Mytonomy is using CRM and expanding the use case. We're advancing patient education. So a major use case in the CRM space is, well, if we want to reach patients, we want to engage them in either we want them to buy something new, or we want them to buy a new service, or we want them to come in and take action on an appointment. We also have to educate them on what that appointment entails. We have to educate them on how to get ready for that appointment, how to go home and continue the care plan, to comply with their medications. So the missing glue in my mind, in my view, looking at CRM and having been in this space for, more than a decade, is that education has often been overlooked as an enabler of driving high levels of activation and participation and engagement, which is ultimately what CRM is doing. CRM is helping you engage with your consumer so that you can get an outcome. And that's one of the best software categories to drive engagement. And so what we're doing at Mytonomy and what I'm seeing really take off is extending that vision of what CRM can do and that application software footprint into an enabler of digital transformation in the clinical workflow, helping providers, clinicians, nurses, doctors replace themselves to some extent, not entirely, but replace themselves on the mundane tasks of educating patients so that patients are actually getting that education when it's most important to them, when they can absorb it. It's not when they're out the door at discharge and they're trying to figure out if their spouse is pulling up the car or if there's going to be traffic, but rather when they can actually go to it, when they're about to change their wound dressing or they're about to give themselves that insulin shot, they can watch that content on Mytonomy. And we can talk about content in a minute because that's a major part of a CRM strategy, one that we haven't often thought of in healthcare, but other industries have really valued high quality content.
A lot to unpack there. So, if I were to play back, one of the things that resonated with me as you were talking about this is just this notion of meeting patients where they are in that journey and able to deliver that content in asynchronous ways based upon where they are and whatever their care pathway is.
Yep.
So if you take that, how do you begin to think through the bold vision of how we begin to reimagine that instruction and experience for patients? And I've heard Mytonomy referred to as the Netflix of healthcare by Gartner. Mm-hmm. And so what's that vision look like for you if you were to fast forward 5 years or beyond?
Yeah. So today, Mytonomy already sits on having built a team of Emmy award winning, just directors and producers, script writers from Universal, from Netflix, from Apple TV, from Prime, who have built engaging consumer oriented content. And they've built TV series or series for cable, series for streaming. We've brought that in-house and created a film studio and looked at the top, 70 therapeutic areas. And we've built now already over 100 TV series with about 10 to 15 episodes each that could easily be on Amazon Prime, like broadcast quality, story-oriented, cartoon animation, live narrative, live actors. And we find that delivering that kind of content, 50% of us are streaming entertainment content every week. Why can't we bring that consumer behavior into healthcare? And that was the premise of Mytonomy, is that we think streaming in 5 years from now will be even higher than it is. We'll be doing more learning, more entertaining through streaming content. So quality of content really matters. And that's where Mytonomy is growing very, very rapidly. I think in 5 years, we'll have even several thousand more episodes available of very high quality broadcast quality content that then is delivered through an intelligent engagement platform that understands you. It understands what you're watching, when you're watching, and it's consolidating and putting all of your information together in one place. So you don't have to go find those handouts that you were given. They'll be in your playlist. So being able to give them tools like Mytonomy that can help save them time and elevate the conversation, elevate the quality and safety level by empowering patients to take on more of that care is the equation. And I think you're going to see in 5 years that home is becoming the epicenter of care.
So Anjali, one of the things that you mentioned around as we meet patients on their care journey and can provide high polished content to them, one of the benefits of that is a reduction on staff workload. And when we talk to our members across the academy, it does feel like the workforce pressures are at really a crisis point. So talk through how you imagine this role or the work that you're doing at Mytonomy can really reduce the burden on nurses and other people who are providing care.
Yeah, that's a great question. We are at a historic situation of staffing challenges, and we're seeing that Mytonomy CRM can help nurses extend their reach, which is what enterprise software does. It helps automate things that can be automated to provide greater productivity. Now, that doesn't mean we'll replace nurses or that we'll replace a doctor. I'm not an entrepreneur that believes some of the Silicon Valley VCs will say, oh, we're going to eliminate doctors and nurses and we'll go to an AI world. I think we will have AI, but I don't think we'll eliminate doctors and nurses. I think what CRM and what content does is it provides you the ability to take something off the shelf that's been filmed at a very, very high quality with a film studio behind it. It's got your message, your branding, and now you're unleashing an entire clinical unit, a clinical care unit, which is virtual and digital and asynchronous. So patients can watch that content whenever they want. And that's where that analogy of kind of Netflix for healthcare comes from.
Yeah, no, that's great. I was going to say, as you were chatting, one of the things that just raised for me was just the sentiment that we hear. And I wonder if you're beginning to track any data around this, that patients who are more engaged generally have better outcomes. And I'm wondering, given some of your data and analytics background, how do you think about just being able to track that for your community?
Yeah, there's so many ways to track that. And we have over 10 validated studies that show that patients who are more engaged do have better outcomes. And it's not just, it actually applies to every patient. We have people in COVID who have been telling us with our COVID content, we're saving lives, that people are watching content because they trust it. It's from their provider, it's from their hospital. And that's, if you think about, well, where do people get content? Where do people seek medical advice from? Where do they trust medical advice that they seek? They trust medical advice from their doctor and nurse. And so if our doctors and nurses are then delivering a video streaming platform with an engagement platform underneath it, then you've got a real winner that can save nurses and doctors time because patients will adopt it and it's accurate information.
So on your accuracy thread, I know one of the things that's really been animating you most recently is creating content that really gets to some of the poor information that's out in the orbit. And so this notion of taking some of the resources that you have and really trying to combat misinformation. Can you talk a little bit around how you focus there?
Yes, especially with COVID, there's just been the pandemic has really been a huge challenge for all of us. And yet we don't all fall in line and take the advice from the CDC or the FDA or our government agencies or even our news sources as truth. We are going online and deciding for ourselves what we think online is true or not. And so I think that's been one of the biggest problems in the pandemic has been this lack of trust in credible information sources and people getting their own information from wherever they want to believe that it's true. And that's where Mytonomy has been playing a role because this has been such a crisis. It's essentially like a war zone. And we've been producing content that then is used by hospitals to educate communities about how to stay safe during COVID, how to wear a mask, how to socially distance. And then it evolved. We kept it updated. We evolved it when we got the vaccines and helping people understand the vaccines and the science behind it. And then helping during the different stages when people could get vaccinated. And as information came out about pregnancy and the fact that women who are pregnant should get the vaccine if they can. So this problem of misinformation is enormous. It's a serious challenge to how our democracy functions and whether people will live or die, as we're seeing in COVID. So because we have the ability to produce short films, we decided to do the COVID work at no cost. We delivered it for free. We put it out on YouTube. It's the only content we put out in YouTube in series. We had over 3 million views in our first couple of months. And 750,000 of those views came from watching our Spanish versions of our content.
That's fantastic. That's great. All right. I want to switch gears a bit and just talk about your own leadership journey. And in particular, let's talk about your leadership style. And I guess my first question for you on that would be, can you reflect a bit on how your leadership style has evolved over time? I think about this for myself too. I hope that I show up differently as a leader now than I did 20 years ago. I'd love any reflections that you might have on your own journey.
Yeah, well, as we think about what influences us as a leader, for me, my biggest influencers are probably that I played competitive sports in high school and I performed dance and music. And throughout my youth, even through college and grad school, I performed ballet, Indian classical dance, and piano. And one of the things that I tell our team today is that leadership and winning is really about what you can control, what you're able to control. And what you can control is your effort and your attitude. And I think early on, I used to look at the scoreboard quite a bit. Early on in life, I used to look at the scoreboard. And now as a leader, I look at the effort and the attitude, and I really don't look at the scoreboard. And I think that's where it's a major change.
Yeah, that resonates with me. Although I don't know, I joke with my children that I was a high school debate champion. I was never quite athletic. And I think debate is a sport. I think they give me a hard time for that. So
I agree with you. I was a high school debate champion too. I was Lincoln Douglas state champion. It's kind of funny.
That's amazing.
Yeah. I can see that in you. That's great. You're always like great with articulating a viewpoint and helping other people understand it, which is one of the things I think debate gives us.
I agree. Thank you for that. What about other influences? Can you talk a little bit about daughter of immigrant doctors, a woman of color? I think the data on women CEOs, I think there are 2% of women CEOs identify as women of color. Talk a little bit about how that journey has been for you, if you would.
When I think about that, I think about my parents, because they really taught me how to survive and how to thrive in the face of uncertainty. And I think probably this will resonate with many children of first generation parents who immigrated here, because you have to get very comfortable with not being comfortable with the status quo and living with uncertainty, because you don't have the luxury of a map that's being handed down to you from generations before. You have to create your map. You have to create your path. So you learn at the core to remain optimistic, to solve problems as they come and not get too tightly wound up, not be rigid. Not being too rigid is really important. So I think those are some of the influences. And my parents were both researchers, so they were very analytical. They were both doctors, and they left Ohio State. We were Buckeyes early on in our life, and they left Ohio State to go to Eastern North Carolina, Greenville, North Carolina, to help start a medical school, because they saw the opportunity of creating something bigger than where they were from the ground up. And so that's where that optimism and that innovation and that sense of purpose, I think, comes from for me.
I think that's great. I also wonder, how has the pandemic influenced the way that you lead?
So the pandemic was a huge situation of uncertainty. And I think it required me to be even more flexible than I ever thought I could be, and to quickly adapt to new environments that were rapidly changing and emerging and growing so quickly. I mean, we grew. We were named to the Inc. 5000 list last year in 2020, and we had a 377% three-year trailing growth rate. In 2021, we had a 585% trailing growth rate. Going through that kind of growth year over year over year during a pandemic was really challenging, because you're hiring people on Zoom that you've never met and integrating them into the team virtually. And I think business, like healthcare, is about relationships. And so it becomes very difficult to establish real, meaningful relationships. And so as a leader, I had to think of new ways. So I started sending out care packages, right? I started sending out snack boxes. And I can't tell you, that was so popular with our team, because they felt
power of a good snack.
Right. Yes, everybody loves a good snack.
That's right. That's right. I also think too, you mentioned the growth path and the speed at which that's happened. Even while growth is generally a positive thing, I've noted at different points in my career that can also sometimes be unsettling for teams, because by definition, it means that new jobs are being created, responsibilities are being shifted, probably puts a premium on communications, both the pace and frequency of that. I don't know if you have any advice for people who are charting an aggressive growth path as a CEO. How does that even really shape?
All of it plus, right? So as a tech company, we were already really great at remote work in several divisions, but our studio, our creative team, which is about half our company, was not. They really valued in-person work. And I think you hear the same thing from Netflix and Peacock and other studios that are producing content that people really like to work together and work in person and collaborate, because those ideas beget ideas. So if you're in a creative role, you love those hallway conversations because it triggers, it's a catalyst for you to think of other things. And it's hard to do that on Zoom. It's really hard to have that impromptu creativity. We tried things like virtual meetings. We ran a customer meeting where we all went into the metaverse. We all had Oculus headsets, and we spent 2 days and everybody had enormous headaches, right? Like it was great to see everybody's avatar, and there was a sense of connection in the metaverse that's very different than Zoom. But I think we're still trying to figure out some of the physical pieces of that to sustain longer meetings in those environments. I mean, you can do 30 to 45 minutes, and that's about it for a large group, because everybody's physical toleration is still very different. So I think we're still kind of figuring that out, because you can do cocktail hours and learn about making pizza together remotely. And it's just not the same, right? We're humans. We like that human connection. We're storytellers. We want to interact with each other physically. So although we're really great at Zoom and we're great at remote work as a software and a tech company, I think when you bring diverse groups of teams together, especially in big companies, you start to see the differences, and not everybody does great on Zoom. And so we've got to find new ways, new hybrid ways of we've opened our office back up, and I think that helping to bring people in for retreats and department meetings and have longer time together as we re-engage in-person meetings and communications.
I mean, the core of what we spend our time on at the Academy is bringing together folks in curated sessions. I was just in Palm Beach earlier this year with our finance executives. We probably had 100 people gathered and did it in appropriate socially distanced ways and such. But there is such an appetite for people to come back together and really begin to reconnect. So I share that with you. So I've got 2 final questions for you. One is one that I ask all my guests, but one is just tailor-made for you, which is you are in the content business, and we've talked about the Netflix analogy a bit. On your quiet days when you're trying to maybe reset, do you binge watch any content that you would share?
Oh my gosh, absolutely. I loved Silicon Valley. I think I watched it twice. I binge watched it probably twice. It was just, there were so many accuracies there that were just hilarious to see, having, grown up in my early part of my career in Silicon Valley. My husband, who's also co-founder with me at Mytonomy, was ex-Google. So we just really laughed at that. I love Ted Lasso. I love A Million Little Things. That's all, but I just love some of these shows. And when you find a good show, it's kind of the thing my son, who's now 12 and in 7th grade, and I do, is we find a good show, a whole series, and then we watch that together. And so I love it.
It's awesome. All right. I'm adding Silicon Valley to my list. I have not seen that series. All right. My final question, one that I ask all of my guests, which is, if you could invite 2 people for a conversation at a table that you personally curated, who would they be and why?
Well, I would invite Malcolm Gladwell or Dan Ariely or Dan Pink. I just love behavioral economists of our time. I loved reading Outliers. I'm reading David and Goliath now. I love Dan Ariely's work at Duke as a professor of psychology and behavioral economics. And not only do I find these kinds of researchers interesting, but I think understanding rational and irrational behavior in the context of healthcare is really important. As a tech entrepreneur, trying to solve challenges that ultimately come down to human behavior.
I love that. Well, Anjali, I hope that you and I will be around a physical table at some point together in person soon. But until then, it was really lovely catching up with you today.
It was lovely. Thank you so much, Renee.
Thanks again for joining me at The Table. The Table is a podcast produced by the Health Management Academy. Make sure you catch future episodes by visiting our website, theacademytable.com, or by subscribing on the podcast platform of your choice. And if you have suggestions for topics or guests, I'd love to hear from you. Please drop me a note at renee@hmacademy.com. I look forward to talking with you soon.